Today, I have a very special guest with me. I first found out about Dr. Brooke Goldner from one of my listeners who asked me to check out her program to reverse lupus. She is a medical doctor and author of multiple best-selling books, including Goodbye Lupus and Goodbye Autoimmune Disease, and she has a very compelling personal story. I'm Dr. Vicki Petz Casper. I practiced obstetrics and gynecology for 20 years until I landed on the other side of the sheets as a very sick patient. When my own body betrayed me, I took a handful of pills to manage my disease and another handful to counteract the side effects. My health was out of control. Through surgery, medications, and lots of prayers, I regained my strength only to face another diagnosis. My doctor challenged me to make radical changes through lifestyle medicine. Now I feel great and I want to help you make changes that make a difference. Healthy Looks Great on You podcast takes you to many medical schools so you can learn the power of lifestyle medicine. If you're ready to take control of your health, you're in the right place. Whether you're focused on prevention or you're trying to manage a condition, I'll give you practical steps to start your own journey toward better health, because healthy looks great on you. I am so excited to have Dr. Goldner on our program today. Dr. Goldner, tell us a little bit about yourself and your program.
Well, I'm a disease reversal specialist. And so what that means is I specialize in how nutrition and lifestyle impact cellular repair and immune function. And it sounds kind of weird, I'm a pioneer in this field, but it all came from my own experiences. So I was actually a patient long before I was a doctor or an author or any of the things that you mentioned in my intro. I was diagnosed with lupus at 16. And it is Lupus Awareness Month, and so it's important to highlight this, but really it's important to highlight it all the time, that people are getting sicker and sicker. Lupus has become even more prevalent. But back when I was diagnosed at 16 in the 90s, it was something that wasn't even heard of in people as young as I was. Now I've actually helped kids as young as 2 reverse this disease. But back at 16, I had arthritis, migraines, I had rashes, and I had kidney failure. So to survive my own childhood, I was on high doses of medications every day. I was actually given experimental treatments because the current medications at the time weren't enough to save me. And my doctor said if I didn't do the experiment, I'd be lucky to live 6 months. If you want to be convinced to doing an experimental treatment by your doctor, that's actually exactly what to tell someone. So obviously I'm sitting here and it worked, but it was very difficult. I mean, from 16 to 18, when most kids are thinking about college and prom, I was thinking about those things and how to study for my AP tests around my chemotherapy sessions so that I, would be able to get all the work done in between all the vomiting. So it was difficult, but I came from a family that's extremely resilient, one in which I learned that you can't control what happens to you, but you can control what you focus on and the future you want to have. I come from a family of refugees from the Holocaust. So my family, they're survivors and they're gritty, and they've also always focused on love and joy and passion. And so I was told, you're not this disease. You will do beautiful things in this world. You just got to focus on when you can do them and how to get them done rather than walk away from them. So I just decided if I was going to have a short life, I was going to pursue every dream and live at level 10. And that way, even if I went out early, I would have so much more done than maybe other people do in a whole lifetime. That's a normal length. So that's really how I got started. And I was very fascinated in the sciences already before I got sick, but the way my doctor saved my life inspired me too. And so I actually got my last chemo 2 weeks before starting college, and I'd gotten a scholarship to my first choice at Carnegie Mellon, and still graduated in the top 10 of my class in high school with all the illness, because I just studied around everything and worked hard and proved to myself that I could do hard and I could still succeed. And then I went on to medical school and I still had lupus, even though I was considered in remission with the kidney failure, meaning I could stop the chemotherapy treatments. I still had recognizable damage. I had protein in my urine, which shouldn't be there. I had abnormal labs. I still had positive labs for lupus all the time. I still took medications every day. But I was able to still move forward. I could take medicine for pain, for migraines, arthritis, everything, and still go on. In medical school, I got very sick again with a new antibody, and that's how lupus is too. It is chronic, it's inflammatory, and it progresses over time. And so at first, the disease attacked my joints, my kidneys, then it started attacking my blood and created blood clots. And so I was having mini strokes where blood clots were going into my brain, giving me double vision while I was rounding on my own patients in the hospital and medical school. And lupus, as an autoimmune disease, it's basically where your own immune system, which is supposed to be the defense for your body, right, to make sure that you stay well, instead, it's actually attacking your own tissues. And for me, that was, my kidneys and my blood, my joints, my skin for rashes, but it can be anywhere. It can attack the nervous system, it can attack the heart, the lungs, anywhere, and you never know where it's going to happen next. So med school, again, I got very sick. I had to take blood thinners and was told I had to inject myself every day for the rest of my life because of to avoid strokes. But don't hit your head because then you can bleed into your head. And that's just how I lived with it and still pursued every dream I had. And I thought that would be my life. And I thought maybe my contribution in medicine would be teaching my own patients that they could still prosper with chronic disease and being an example for them and a source of hope for them. And I thought that would be my role until I met my husband, who was a specialist in metabolism and how nutrition impacts fat loss and muscle building. That was his passion. But when we met and he wanted to marry a sick woman, and I told him, I can't have children. I'm going to become disabled. You're going to have to take care of me when I become disabled. I'm going to die at a young age. Like, this isn't really what most men want to sign up for. And he said, absolutely, that he'd take a short life with me than a lifetime with anyone else. And I decided to do his nutrition plan to look good for our wedding. And he had to make some adjustments to it because of my own dietary needs. I was the first vegetarian he'd ever met. And I did get the results that he got with his clients in terms of fat loss and muscle building. Went from a size 11 to a size 3 in 3 months. Wow. But I also, for the first time in my life, had no symptoms of lupus and normal labs. And the short version of the story is it has now been 20 years since that happened. It'll be 20 years in October, so just under 20 years. I've never had a relapse of lupus. Everything healed. I've never had a blood clot again. My kidneys are perfect. And I was able to have children. And I'm 48 years old. When I was told at 16 I might have 6 months to live. So everything that I thought would be my life didn't happen. And when I got well, my husband and I changed our focus to understanding how the nutrition that affects your metabolism could also affect cellular repair. And that's what we've been doing. We released our protocol to the public back in 2015. I do a lot of free work for the public. Every Wednesday, I do live Q&As. For Lupus Awareness Month, I have classes that are online for free. And people all over the world are now healing their diseases just using our protocol. And it's been a beautiful, amazing thing. We work together, and now we've helped thousands of people around the world do the same. I just got a text from someone this morning who I've never met, who's just gone to my classes and read my books and letting me know that she healed her disease because of my stuff and wanted to say Happy Mother's Day to me. So it's a pretty amazing thing. And that's how I got to doing what I'm doing now.
That is an absolutely incredible story. And I think that we sometimes in the healthcare profession discount the importance of resilience. And with my own autoimmune journey, mine was sort of the opposite. I'd been a doctor for 20 years when I developed myasthenia gravis, and it ended my career as an OBGYN doctor. But that resilience was built in, and I've been able to do lots of things since then. But I think that's important for people to understand when they're facing chronic diseases. And people with autoimmune diseases, we always say we're the only ones strong enough to kick our own butts because it attacks your own body. But I wonder, in your journey, at any time, did anyone mention nutrition as a thing that you needed to do for your body?
The only doctor that mentioned nutrition was my kidney doctor, my nephrologist, who told me that pizza was the perfect food because it had all the food groups. So, wow. My parents owned a pizza place, and my mom would always give free pizza coupons as thank yous to my doctor. So I think he was just encouraging the come up, but yeah.
Yeah, well, and I've talked to people who have autoimmune diseases and even people specifically with lupus, and often they're told you should eat an anti-inflammatory diet. But No one really tells them what is that and how do you implement that.
And if you Google it, oh goodness, you're going to find all sorts of garbage. It's one of the reasons why I do so much work for the public for free, is I want them to know, like, this is truth. It's freely available. I believe everyone should have the information that can save their life. My husband always says to save their wife, but it is really important that people can understand the difference. And it's one of those buzzwords of anti-inflammatory. Just this morning, I was looking at the news app. I like to look at my news app in the morning, and there were so many articles that use anti-inflammatory and saying your anti-inflammatory breakfast. I'm like, oatmeal? There's nothing anti-inflammatory in oatmeal. Like, tell me where it is. It's not there. But everybody wants to say they're anti-inflammatory. And in a lot of cases, diets that proclaim to be anti-inflammatory are just less inflammatory than maybe the standard Western diet, but they're not anti-inflammatory. To me, anti-inflammatory means it actually brings down the inflammation levels and heals the cells, heals the organs. And that's not the case for many of the protocols and programs that are highly touted by influencers online. So it is a big uphill battle to get really good information out there, because, now in the days of social media and everything we have, on the positive side, we can do what we're doing right now and talk and bring good information to the public. But on the negative side, anyone who has a camera can make videos and proclaim themselves to be experts in things that really don't have the experience to authentically be able to do so and give real information to people.
So, is it possible to tell us in a nutshell what's different about the advice you give?
Yeah, so there's a few things. Number one, I'm 100% results based. So oftentimes when people will, come back to me, they'll say, "Oh, well, my doctor said this, or I read this," and the information they're getting is somebody giving their thoughts and ideas. And the thing about humans is our thinking is wrong a lot of the time. No matter how smart we are, our thinking is wrong a lot of the time. And so I think it's the most respectful thing to do for the public is only to ever speak from results. Any advice I give comes directly from me having results proving that to be true. For example, I teach people how easy it is to get anti-inflammatory nutrition in through smoothies. You see, I'm drinking mine right now. It's not a prop. I do that. Super easy way to do it. Most anti-inflammatory things you can eat: high nutrient vegetables like cruciferous vegetables in their raw state, omega-3 fatty acids from flax and chia seeds, and getting enough water intake, right? Here, I'll show you my other prop, right? So I get my water intake, right? You put all those things into a blender and blend it. Now you can reduce inflammation, accelerate the healing process while working, while talking to somebody, right? And I had, when I first started teaching this, some other doctors were coming out saying, "Oh, no, you can't do it in a smoothie because there's enzymes in your saliva that are necessary," and all sorts of things. And they were just their thoughts. It was their theories. None of them had said, we tested smoothies versus salads and found it to be true that people do not get the benefits from smoothies and do get benefits from salad. Not only had they not tested it, but finally it has been tested. And they showed that people absorb more nutrition from smoothies than from salad. It turns out once the blender blends it up, our bodies can more readily absorb the nutrition. But people were arguing back with their own thoughts versus here's the tests that I've done. Whereas I can say, I have worked with thousands of people who have used these smoothies and reversed not just lupus, but rheumatoid arthritis, multiple sclerosis, myasthenia gravis, scleroderma, mixed connective tissue disease, as well as things like heart failure and diabetes. So results are extremely important, and it's something that I know has created a lot of trust with the public. I had someone say that to me the other day from my rapid recovery group where I work with people every day, that what drew her to me was that she knows she can trust what I say, because if I see something doesn't work, I say it. If I've never tested it, I say I don't know because I've never tested it. And if I say something to be true, it's because I've actually tested it. And so I find that as a former patient and as a physician to be the most authentic and reliable thing that we can do. So being results-based. And two is, again, working with what we know works and testing. My husband and I tested our analysis of what we thought had worked for me for free for over a year with volunteers to prove to ourselves that what we were doing was reliable and reproducible. A lot of times people come forward and say, "I got better, do what I did," but they don't know if they got better because of what they did or in spite of some things they did. And we've evolved over time, having worked with so many people, to really just include the ingredients we know are essential. And that's very important too, to have that, to be able to say, if you're doing what I do didn't work, we don't know why. We do. We know exactly what works and why. And that's why we've also been able to make it very simple, easy to digest if it were, and then released it for free. So for example, we have a website, smoothieshred.com, where my husband put up, he created as a public service. You can just go there for free, and we have free recipes, videos, tutorials, everything people need to get themselves healthy or to get ripped if you want to, if you're just looking for the physique aspect. And it's there for free. We don't need to know your email address, nothing. So it's given there, but the smoothies are a way we've been able to simplify it, to say, oh, you don't want to eat a bunch of raw kale? Shove it into a blender, add the flax or chia seeds for your omega-3s, which create your metabolic rate, enhance cellular communication, enhance cellular repair, and create the anti-inflammatory immune system. You put that in, you add your water intake, fruit for flavor, blend it, and now you've got this really simple way to deliver maximal nutrition we call hypernourishment, which is an overdose of the nutrients your body needs to repair itself. And you can drink it through a straw. You don't have to sit all day thinking, did I get every color of the rainbow? Did I do this? Do I do that? You don't need to order supplements from Peru. You can just simply go to the supermarket and give your body what it needs to recover.
And I get asked this question a lot. So, and I try to eat plant-based as well. But what about protein? People are always concerned that they're not going to get enough protein.
Yeah, and they've been programmed to think that, right? So protein has been the thing that the animal industry has hung their hat on as a way to keep people hooked into their product, right? So the first macronutrient ever discovered was protein under the microscope. And scientists have ego. I discovered the key to life. I saw it. It's a protein molecule. That must be what we all need. And every time scientists think they've solved everything, it turns out later it was a mistake, right? Like they thought that benzodiazepines was the cure to anxiety. 20 years later, we're still trying to get people off of all the Xanax and they're shaking out of their skin, right? So whenever we think we found, the one thing, right, we're often wrong about that, right? And so everyone started saying protein, 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 right? And even now that we know that the majority of diseases people are facing today are caused by an overdose in the highest protein products, like eating too much animal products is the reason we have heart disease as the number one killer. It's fueling the cancer epidemic. It's, colon cancer. We've known that for over 20 years, that is fueled by high meat intake, right? As well as what we've seen with autoimmune diseases and other diseases that are progressing and spreading as the Western diet does. And yet, in spite of that, every commercial, it's all about protein, right? So it is not anybody's fault if they think protein is important. In fact, even doctors today are still saying, oh, you need more protein for healing. You need more protein for your bone density. But again, it's not science and results based. So number one, we get protein from everything. Every amino acid we need is in plant foods. And the one way to know that you're getting enough protein is whether or not you are losing strength, right? So a lot of times what people are worried about, so I put people on intensive programs where they're really focusing on hypernourishment, high raw foods, right? They're not eating meat, they're not eating beans. Oh my God, are they just losing all their muscle? Not at all. We have professional athletes, when they get autoimmune disease, they usually come to us, and they really, especially because of my husband's expertise as well, want to work with people who understand exercise science, which is his specialty, as well as medicine. And he has found, so for example, he recently did a program called Rapid Recovery privately with an Olympic level athlete. And she had lupus. And then she was having trouble using her hands and she needed them for her sport. And at the 3-week mark, her labs were already negative for lupus. And when she went back to she was doing her training at the time, 5 hours a day of training. Her trainer said at the end of the 4 weeks of eating just these raw foods with no focus on any extra protein intake, no protein powders, nothing, just mostly salads and smoothies that were focused on high nutrient vegetables and omega-3. She broke her own personal records for speed and strength. And she was so effective, her trainers want her to stick with the program. They said, you've never been this good before. And so switching from the typical diets that are given to Olympic level athletes, focusing on your protein and all that, instead, she got better results doing it this way. And so the results, again, show the truth. And the results show that people continue to get stronger and fitter without any kind of focus on that additional protein. My husband also has a book called Miracle Metabolism, where he showed how he's developed his research over time and found that he could get fitter faster with more strength building and more breakthroughs in his own ability to lift, for example. So you can't be able to lift more without getting stronger, which means your muscles are growing, right? He was able to get those personal gains and break his own personal records faster on a plant-based diet with less than half the protein he needed to do the same thing on a meat-based diet, leading him to believe that we actually absorb and utilize protein better from plant sources. So it's a difficult thing for most folks to unwind because it's pounded into them from every source, from commercials to websites to even their own doctors who haven't really tested this. But the truth is, it's not really as important as it's made out to be, and we're already getting more than we need. Most people out there aren't Olympic level athletes. They're drinking a protein drink and they're sedentary. And if you drink excess protein drinks, if you eat excess protein containing foods and you're not exercising, it will build body fat, not muscle. You do not build muscle without exercise asking your body to build muscle. So it's a big mess. It's a big protein mess that we're still trying to unwind for people. And we have to fight people's beliefs many times when trying to get them into a program. And we always just tell them, listen, let's look at the results. Keep going to the gym. Let's see what happens. If you get weaker, we'll examine that. It doesn't happen.
That's amazing, and I 100% agree with that. And again, I think it's important to focus on other things like purpose and resilience and joy. All of that is going to keep you motivated to implement the nutrition that you're advocating. Are there any other aspects of life and lifestyle that you focus on?
Absolutely. So, my first book, Goodbye Lupus, is all about it's my story and the nutrition protocol, how to reverse 6 steps to reversing disease with supermarket foods. Very, very simple, short to the point book. And it's been effective. It was a bestseller it was pre-published all the way until recently. Now it's in second place only because I just released a new book that put it into second place. So it's very, very effective, but it's just focused really on the nutrition and the inspiration from my own story. But my second book, Goodbye Autoimmune Disease, that came out in 2019, was all about the other aspects of life that affect people's disease states. So things like depression and anxiety and trauma that raise people's inflammatory markers and make people sicker, but also then affect their ability to stick with a program. If you are someone who's depressed or anxious or traumatized, and you use food as comfort, for example, it's going to be very difficult for you to give up those things you're addicted to in order to then eat the foods your body needs to recover. And so as someone I'm a trauma specialist, and I find that I use that same muscle helping people every day in their nutrition and lifestyle, because you need to get to a place where you're emotionally so joyful and fulfilled that you don't need food to be fulfilling. It becomes so, right? Once you get used to eating healthy, after a few months of it, you actually start craving those foods, and it's so different. A lot of people think, cravings usually spike after the second week, and they'll think, oh, I can't do this, I can't live like this, and they often quit at the end of the second week, but don't realize that your cravings will change and how fulfilled you are on food will change. But in the early weeks, you really do need to focus on your fulfillment and passions. And so we have a lot of our focus, especially in our rapid recovery groups. The nutrition protocol is simple. Most of the time we spend is helping people unwind all of the things that keep them addicted to the wrong food. So addiction, trauma, poor self-esteem, perfectionism. We work on forgiveness. We work on self-care. I teach people the pathway to joy and passion that has helped me and so many of my clients and patients also be able to live really amazing, happy lives, even while sick, which then accelerates their recovery. So you're absolutely right that it is so multifaceted, and people who are already happy and purposeful find that within days to a few weeks of changing their diet, they already feel amazing. And then everyone else needs to work on all of those things at the same time. And it's one of the things that I love to do is hold people's hand through that process.
I absolutely love that. I'm so excited that you were able to join me today and share all this wonderful information. I think the people that listen to me and have heard my story and my journey are really going to connect with this. I'm super excited. Thanks so much for being here.
Oh, it's a pleasure. Thank you so much.
The information contained in this podcast is for educational purposes only and is not considered to be a substitute for medical advice. You should continue to follow up with your physician or healthcare provider and take medication as prescribed. Though the information in this podcast is evidence-based, new research may develop and recommendations may change.